Hi, I'm Dr. Jessica. I'm here with Hannah, and she works at Minneapolis Integrative. And so, Hannah, could you introduce yourself, please, and your profession?
Yes. Thanks for having me on. I am a family nurse practitioner at Minneapolis Integrative. I actually started there in November. However, I've been in functional medicine for a couple of years now. I practiced in North Carolina for the last 8. I see most of our kiddos in our clinic now and saw kiddos historically, but I also see a lot of women's health and men's health and kind of a combination.
Awesome. So, how did you specifically get into integrative care? Like, since you're a nurse practitioner from background, how does that role transition to functional medicine?
Yeah, I really am so grateful. Like my grandma Sue was huge in terms of integrative medicine. And that's when like celiac disease was around. And I feel like everyone was like, what the heck is celiac? It just wasn't talked about. And so I got to see some of that in her like cancer care and treatment. And then even with my mom, like my mom had always been more on the side of like, let's go to chiropractic care, let's try supplements. And so I feel like from a very young age, I got introduced to this world and then just became super fascinated about how there's so many ways that you can treat people and it doesn't always have to just be like here's a pill, here's a pill, here's a pill of like how do you get through all those layers to kind of uncovering. So
That's amazing. So, when you mentioned that you're working with the most of the kiddos in the office, what kind of things do you see most commonly in kiddos?
I feel like I'd say top 3 is probably like GI issues, whether that be like food sensitivity, constipation, different in terms of like stomach pain, things like that. I'd say like a lot of like skin, so like eczema, psoriasis, different functions. And then I kind of put this in like a broad topic, but I'd say emotional dysregulation. So anything from anxiety, ADHD, insomnia, just like inability to focus overall.
Awesome. And do you want to touch on the or the gut brain connection
Yeah.
a little bit
It's
too?
huge. So I try to say like too is like that vagus nerve connection is like at one point we were all one cell, right? And then as we grew, it became in two very distinct in different areas, obviously. And so the louder things are up here, the more that affects our GI system and then vice versa. So a lot of the times their primary concern is anxiety, but what I find when we do like GI map testing or further explanation is their like gut's a wreck and treating the GI or treating the gut, their anxiety goes away. So pretty fascinating how like the two connections are strong.
I love that. When do you know, how do parents typically find you when they are reaching out for kid gut things or
Sure.
anxiety related conditions? Like, how would they know to come in type of
I
thing?
feel like what I've heard from parents is like oftentimes if they're not well, like if they don't know much about integrative or functional medicine, usually it starts with like they're at a chiropractor and a chiropractor's like, this just doesn't seem right to me, or they go to somebody else. What I've seen historically from my parents, unfortunately, is they've gone to lots of different specialists and just feel like they've been like let down are still left with answers. And so that's often when they like turn to the functional medicine world.
Okay. And you do a lot of blood work and GI mapping, right? That's
Yep,
what
so GI
you.
map is a stool test, which is great for kids. So that way we don't have to do any pokes. I try to be really conscientious of that because it's a big and scary thing, right? And like a lot of even adults don't like that. So I try to say of like, if we need blood work, yes. But if there's any ways, there's lots of like urine testing through like an oat, which you can look at like a lot of methylation issues, mold, fungus, kind of all of that. But we get creative. I
Okay,
say that like I hate poking kids. I mean,
yeah,
if we need to and it's a part of their care and I think it'd really make a difference, then we'll do it. But
that makes sense.
yeah.
Is there an age range where 0 to 16 that you see most ages in, or
I try to say 2 and up just because that's where functional medicine testing, unfortunately, they're like they don't have a lot of like research or recommendations for 2 and under.
okay,
There's like different food sensitivity and testing you can do before 2, but most of the standardized testing wants they won't see patients until 2. So I'm kind of seen by that. So a lot of it more is like before 2 is more like homeopathy based or different kind of things there. But yeah, I see probably 2 is my youngest patient, and then you still consider them pediatrics. I'd say till 18, a little bit
Okay.
further, but yeah.
Yeah, that's fair. Yeah. And with autoimmunity in kids, is there anything that you see commonly with the autoimmune and stuff like that?
So, yeah, biggest things that I've seen is like Hashimoto's starting younger and that early diagnosis for kids starting. I tend to think of like this whole world of it's called epigenetics. So we're all born with different genes, and at some point or some trigger in our life, these genes can turn on that make us more susceptible to either autoimmune disease or different functions. And so I try because I know there's a lot of discussion about how those autoimmunity like have increased in children. And so I try to talk to parents about, you can only control so much, but controlling a lot of their environment is huge of like, decreasing those like endocrine disruptors through like candles, scented products, things like that, trying to watch or be a little bit more conscientious of food choices when able. I think that's going to be like your biggest proponent in that.
Okay. Okay. And that goes with finding out if there's any sort of like allergens going on, disrupting the gut, leading to some sort of autoimmune. And that also goes with like food dyes and stuff like that that might contribute to gut things too, right?
Yeah, and it's like not always even just like in the gut too. I think that a lot of it is just like, broad systemic of like,
Mhm.
mold in the environment we know can cause those triggers or flips to be turned on. And so like, being conscientious of that in Minnesota of like we have a lot of moisture, unfortunately.
Yeah.
And we have a lot of basements.
Yeah.
So things like that. I think it's just, I think I don't want parents to have too much information where that makes them anxious and feel like they always need to do something, but just also knowing like it's little things.
Yeah. Little changes in your day-to-day type of thing.
Yeah,
Like
absolutely.
start one place and then maybe build one thing next month and then one thing the next month type of thing and don't tackle it all at once, right?
Yeah, I got the environmental working group app and I said I was kind of like a little bit of a psycho person, but I got all the garage sale stickers. And so I did like green, yellow, and red. And things that were green were good, so I didn't have to change them. Things that were yellow was when I had the availability financially or just the energy time. When I was able, I was going to switch those out. And red were more of those hard trigger stops of when this is out, I'm going to switch with something better.
Got
And
it.
I thought that was more manageable from a lifestyle and like having a
Mhm.
child of my own to be able to tackle it in more steady phases than trying to like throw out the whole kitchen sink and start over.
That's a really good idea. I love
Yeah.
that. And that goes
Yeah.
with like even just throwing away things in your home, just in general. Like I don't need this pair of socks that has a hole in it. I'm just gonna put it in the red zone right now. Like it's totally fair.
I
You're
know.
gonna
I
feel that.
still have a shirt though from like, I have clothes from high school and I'm like,
Yeah.
why? Like, just let
Well,
go.
it's just sentimental at this point.
Yeah,
It's fine.
nostalgia. Yeah.
Amazing. Is there anything that you see with allergy related things that you're like, okay, these are my top three that I absolutely always recommend type of thing? Or what is your go-to
Yeah.
allergy type of protocol?
I would say like Allergy Calm by Boron is really good. So that's kind of like more of a homeopathy based, really you can just use it as needed. You can increase the dosing every like 15 minutes for those kids that are more symptomatic. So I like that because it's just as you feel like things are ramping up, you can give it like prophylactically or before an event. So if you know kids are really sensitive outside, I'd say for those kids that have like allergies that overlap with like asthma concerns too, really like using an air purifier in their room. They did some studies that showed that like between the asthmatic groups, one was on medication and one just had an air purifier, and the air purifier group had better regulation in their asthma control. And so I think that's like a easy kind of life thing. BHIS Junior is wonderful. It's a chewable form. It has like quercetin, stinging nettle, all of those work. And then I always tell people I'm like chiropractic care, right? So huge for adjustments of you can get a lot of congestion in this time period. So you need to make sure that you're getting proper drainage. Xylear nasal spray is also a good one for kids with that. But I really rely on you guys more for my allergy issues to just helping because if there's a lack of that, blockages or imbalances, that's also going to affect them. So I feel like supplements may take them 50% of the way or 60% of the way, but using those adjunct cares is going to be so huge for that.
Oh, that's amazing. And what Hannah's meaning by drainage in our clinic, it sounds so bad. But we're gonna go inside the mouth. We're gonna target the eustachian tube. There's a lymph node that lives like right about here, and we're just gonna help sweep it out. And so that's like the ending point for all of our sinuses. So we'll do a little bit of like nasal stuff, a little bit of drainage on the face, a little bit on the inside of the mouth, and then we will be doing like neck adjustments because those top upper vertebrae can be a little stickler for allowing that full congestion piece to come full circle. And so that's what Hannah's mean by drainage is all
Yes.
of this type of thing.
Yeah,
So
I think, it's better out than in, right? And so,
100%. And
yeah,
so
I definitely love that.
yeah, you'll definitely notice a lot more draining happening, a lot more boogers happening. So make sure you have your snot suckers ready. But
And I know that, like, I don't know, there was like this big thing on, I felt like it was like a huge TikTok trend of you can just shove garlic cloves up your nose. I have not seen that be successful, just putting that out there. Garlic is naturally antibacterial and antiviral. It's really good for ears of helping with like more of the bacterial side of things, but I don't know that I'd recommend shoving cloves up your nose, but if it
that would
works
be
for
really
you,
strong.
yeah.
To each their own, right?
Yes.
Amazing. Well, thank you so much, Hannah. I appreciate all of your insight. And so if you guys have kiddos with any sort of autoimmune things or any sort of allergens, go see Hannah at Minneapolis Integrative because she is literally the best.
Thank you. Thanks for having me.